Hello viewers, good morning. I am Dr. Buvaneswari from GBR Clinic Fertility Centre, Chennai. Today we are going to discuss regarding blood investigations, and we have been doing a lot of this channel and programs, and we are seeing more and more people are questioning about the blood test. Should we do or not? Like a lot of doubts they have. We are coming here for treatment, we don't want any blood test. Most of them will be telling that, and definitely the blood test is also important. First, safety of your health is important, next only the treatment comes. So here you generally what all the blood tests should be done, and whether it should be done or not we will discuss now. And blood test for the women, basically your hemoglobin level should be known, because sometimes if you are anemic, you are bleeding without your knowledge, and your anemia can hamper the treatment and success rate can come down. Second thing is, when you are anemic, you contract lot of infections. So in infertility we may do lot of procedures which may induce an infection if you are immunocompromised, or if you are pregnant, and during that time if you are anemic, then your blood levels will be less, baby weight will be less, and blood supply to the baby also will be compromised, and preterm labor risk also is there. This is the reason hemoglobin will be done. So many times you would have done hemoglobin blood test outside, but at least within 6 months if it is done in a proper standard lab, then it can be taken. Otherwise better to repeat and complete blood count to know your blood cells count. Second one is thyroid blood test. Thyroid test should be done in fasting, but if you are already taking treatment, you are on follow-up, then only the thyroid test can be done at any time and cross-check, and dose can be adjusted. And second, most common blood test during infertility treatment is like hormonal testing. This hormone testing usually will be done on day 2 or day 3. Either day 1, day 2, day 3, all 3 days can be done depending on the timing and when you get your cycle, and whether you are coming from long distance. You can come even on the day 3 and give the sample. And we do generally FSH, LH, that is luteinizing hormone, prolactin, and certain blood tests we are doing on a second day of the blood cycle. And every cycle, why we are doing this test? Because each and every one is different, and their hormone patterns are different, and the response to the treatment also depending on this hormone profile. So it is variable in every cycle. That is why we are doing day 2 test of this one for everyone and every cycle during the treatment process. If you are having a regular cycle and you are already done once or twice found to be normal, then we don't need to repeat this day 2 hormone test. And next level of hormone test is prolactin, and second level is progesterone. So these testing, why we are doing only in specific conditions we do this test. Prolactin is very important. Many of the patients who are going for treatment are anxious and they don't sleep, they are very stressed. So those patients prolactin level will be high. If the prolactin level is high, then the pregnancy rates are less. So that is why we repeatedly check the prolactin level. If the prolactin level is more than 20, better to go for empirical treatment. If it is more than 30, definitely you need to have a weekly treatment or daily treatment to bring down your prolactin level. And you have to find out what is the reason for high prolactin level. If it is known stress is very high, you can go for a counseling and reduce the stress level, so that prolactin level will come down. Otherwise that prolactin should be controlled with tablets. And other than this, routine screening test will be there. That is any viral infection, routine screening. Why we are doing this screening? Because when we are going and doing procedure, one is that you should not get contaminated. Same way the hospital staff and the equipment should not be contaminated. And when we are processing samples, cross contamination should not happen. All this reason we always screen the test so that that infection will not be transmitted to others. So that is also again once in every 6 months it should be repeated, because there is a window period. After sometimes you may be negative now, after 6 months you may become a zero positive. So those cases we have to repeat every 6 months. If it is cost wise, if you see that the cost is less, if you go and do in a smaller labs, sometimes you can get wrong reports, and this will also reduce your risk in pregnancy rate. Thinking that everything is normal, we may be programming in a different way, but at the end of the day we may not get the success. So if you are going for a standard lab, so we will get the exact value so that the treatment can be tailor made and titrated properly. So this is the basic test. When you go above, age is going beyond 30 years, we start checking your AMH level. That is a special test, it is called special test. AMH is important to know your reserve of the ovary and your oocyte numbers, so that we can plan the treatment, whether we can wait for some more months or we can go for a higher treatment. Everything can be decided on the oocyte reserve. So these are the basic testings are done like this. For the men, again, semen analysis, screening test, thyroid test, all these hormone tests are done. In men, again, when they have a sexual dysfunction, testosterone levels can be tested. If they have a low count, then hormone test like FSH and LH hormone can be tested. If you had a recurrent pregnancy loss, or already you had a pregnancy through treatment but you aborted, or you had miscarriage, then there are set of investigation which can be done on demand. So basically, and we have to do blood test before going into any treatment, because during the process of treatment you may be given anesthesia, or sometimes you may require smaller procedures also may become a difficulty where you need to go for an anesthetic procedure. So all that risk, again, in that period we would have known your medical history and your blood test level, then it is easy for us to convert and take the procedure forward. I think this is a basic information about the blood test, and so if at all, if you have any other queries, and if you have any other blood test other than this, if you are doing, if you want to know, please drop your feedback and comment in our comment box, and you can follow us in Twitter and Facebook, and you can subscribe for further details and further information in YouTube channels. Thank you.